Good morning and welcome to Houston Newsmakers. As this show is airing, there is another week and 5 days before the enrollment period for the Affordable Care Act ends. What does that mean for millions of Americans who otherwise would not be able to afford health care? How affordable is it really, and what might the ACA's future be? Here this morning to talk about those questions and more is Janda, the president and CEO of Community Health Choice Incorporated. It is a nonprofit managed care organization, currently serves more than 400,000 members. Good morning to you.
Good morning. Glad to be with you.
Glad to see you here. Tell me, what is a Community Health Choice and how does that work? I mean, we don't normally associate nonprofit with health care.
Right. Well, we're actually a licensed health maintenance organization, much like Blue Cross or Aetna or Humana, some of the companies that I used to work for in the past. But we are a nonprofit health insurance company that was actually established by the Harris County Hospital District back about 20 years ago. And so we have moved in with the Affordable Care Act into offering individual health insurance policies alongside the bigger, more commercial insurance companies. But we do it on a nonprofit model so that when we have a surplus, we give it back to the community rather than into shareholders or the stock market.
Well, this is something we're going to be talking about this more in depth this morning. This topic is big enough. I think we're going to do a Newsmakers Extra this week on the topic. So I invite you to go to clicktohouston.com on the Newsmakers page to join us for more on the healthcare conversation that we will be having here. Someone would come to you if they're not sure necessarily about what kind of insurance they need. Is that how that works?
That's right. We actually serve two different roles. We help people navigate the health insurance marketplace, but we are also a licensed insurance company, so they can actually choose our insurance just like other plans. So we are one of the 4 licensed companies that are on the exchange or the health insurance marketplace under the Affordable Care Act. So you can go to the Affordable Care Act, the healthcare.gov website, and you can pick Blue Cross, or you can pick another company called Molina, or Ambetter is a new one that's coming on this year, or Community Health Choice, and actually buy your insurance through us. But because we're a nonprofit, we try very hard to not just sell our own programs, but just say we want people to get health insurance from somebody.
Right. But let's talk about the Affordable Care Act and what's currently being provided now in the way of health care. You are now in that group of people who are providing it. The headlines would let us believe that it's not going to be around much longer, that the Affordable Care Act, I mean, you know, you've seen the headlines like everybody else. How much of that should we believe, and what should people do if they are concerned about their health care going forward?
Well, we believe everybody needs health insurance. No matter rich, poor, wherever you are, you need health insurance. Most people in Houston get health insurance through their employer-sponsored insurance. I'm sure Channel 2 has a policy. I have a policy through our company, but many people in Houston don't. And so everyone needs health insurance. So we think the individual health insurance market is going to continue to exist and will grow. We actually like very much what's in the Affordable Care Act around having people be able to sign up with no pre-existing conditions, so they're able to get insurance, which was a big and important change that happened in 2014. The Affordable Care Act is going to evolve and change. We've been advocating for that since the beginning. There were some real flaws in the way it was established, and it was really too complex. And so we're actually been involved in saying, here are things that we should do to improve and make it better so that it is more affordable for folks, that it is simpler to navigate. And so that's what we would like to see happen. Unfortunately, it's caught up in politics of oh, we don't, you have to hate it or love it, and there's no middle ground. So the repeal and replace conversation was something you were just not a part of at all. You said, we can fix things about it and we can move forward from there. Correct.
Let's talk about what's now currently providing going forward here, the deadline of December 15th. What does that mean? If people don't sign up by the 15th, they forfeit their opportunity for health care in 2018?
They don't forfeit their right to get access to health care. What they do is have to pay a tax penalty. There is in the Affordable Care Act, and it is still the law of the land, that if you do not have health insurance, either through your employer or Medicare or Medicaid, then you need to buy policy on the marketplace. And if you do not have health insurance, then you pay a tax penalty of 2.5% of your income. We think that's not a good idea for anybody to pay that tax penalty, and instead they should buy health insurance. If they wait and delay, they may not be able to find a policy that's available to them until next open enrollment period, and that would be really bad if they have a catastrophic event or get sick and don't have health insurance.
You've seen the debate going on in Capitol Hill talking about the tax plan, which now the latest tax plan also includes taking away the mandate that people buy insurance. And a lot of people on Capitol Hill would say, well, you know, we're appealing to those people who said, I don't want to be forced to buy insurance in the first place. On the other hand, the latest numbers I saw indicated that some 13 million people might lose their health care if that part is not included in that. Are those numbers what you think?
That actually makes sense to us. And of course, the bigger issue to me is that the reason to have the individual mandate is to help get the insurance pool, the number of people signed up, as large as possible, and that holds prices down and premiums down for everyone. If you don't have an individual mandate and people can wait until they get sick to buy insurance, then that drives up the price. And so we actually have charging a higher premium for next year than we would otherwise have to do, because we believe the individual mandate may be weakened or go away, and therefore the number of people who sign up will tend to be older, not as healthy, and therefore the costs that we have to cover with that premium will be skewed toward sicker people. So we actually think the individual mandate, while people don't like to have to buy insurance, we think it makes a lot of sense in order to help hold down the premium costs. And that's what most people complain about, is that insurance is just too expensive. So how do you reduce the price? Well, one of the ways you reduce the price is get everybody in the pool.
Right. Well, we obviously, there's a lot to talk about here. We're going to talk about more on click2houston.com on our Newsmakers Extra segment, because there's a lot more, another segment at least online here talking about this. But you would encourage people to go and sign up before the 15th.
Yes,
correct?
Absolutely. Go to healthcare.gov, look at the option. There's about 60 different choices from 4 different insurance companies. Pick something, buy insurance. There's some actually very affordable premiums out there for policies if you're low income and get a subsidy.
60 different choices. That kind of goes against what we've been hearing about.
Yeah, there's actually more choices in Houston this year than last year.
Wow. Okay. Thank you, Ken. Appreciate your time this morning here. I want to remind